My name's Janine David. I'm a GP with a special interest in men's health, and I also run a urology andrology clinic in the hospital. Diabetes is one of the most common causes of erectile problems in men. It's a complicated situation. It's quite multifactorial how the diabetes itself actually causes the erectile dysfunction. Firstly, it's the sugar control. So high blood sugars will lead to erectile dysfunction for varying reasons. One is that it reduces a substance called nitric oxide, which is a very important substance for erections that will allow blood flow to the penis, thus creating an erection. Also, it causes problems with the nerves. So damage to the nerves leads to decreased sensation in the penis, which can also lead to a decreased arousal, decreased erections. It causes problems with the arteries. Again, as we said, we need a good blood flow to the penis to cause the erection, and problems with diabetes cause problems with blood flow to the arteries, so you have problems with erections. Diabetes itself, type 2 diabetes, is actually also associated with lots of other conditions, such as hypertension, high blood pressure, high cholesterol. Men with type 2 diabetes tend to store fat around the belly. All these things lead to problems with erections. So it's not just the diabetes itself, it's the comorbidities or the other illnesses associated with diabetes that can cause erectile problems. There's two types of diabetes, type 1 diabetes, type 2 diabetes. Less than 10% of men with diabetes will have the type 1 diabetes. 90-odd% of them will have type 2 diabetes. Now, the difference with respect to erectile dysfunction is that both types can cause an erectile dysfunction. However, it's all the associated conditions with the type 2 diabetes that augment the situation and cause more problems with erections. So the association with lifestyle factors such as weight gain, the hypertension, the high cholesterol, all these things are associated with a type 2 diabetes and are more likely to cause problems with erections. So although you will get erection problems with type 1 diabetes, it's far more common in men with a type 2 diabetes. And not all men with type 2 diabetes will get erectile problems. However, the higher the blood sugar, the more likely you are to get problems with erections. If you're diabetic, you're twice as likely to have erectile problems as if you're not diabetic. Between sort of 35 to 70% of men with type 2 diabetes can have erectile problems, and this increases with age. So looking at over 70, 90-odd% of those men with type 2 diabetes will have erectile problems. The most important thing is to optimize your sugar control. You can do this by diet or by medication. But also lifestyle factors are so important. So you need to try and lose weight. The more weight you lose, you get better muscle, less body fat around the abdomen, which this is also associated with a testosterone problem. The fatter you are around the belly, the lower your testosterone, which again can lead to erectile dysfunction. It's really important that type 2 diabetic men don't smoke. Smoking has a really negative effect on erections. Even smoking 3 cigarettes a day can decrease your erectile potential by 30%. So it's really important not to smoke. It's the nicotine itself that can cause a problem with erections because the chemical can interfere with erections. But also the smoke can cause narrowing of the arteries, which again decreases blood flow to the penis, which causes erectile problems. Lifestyle, other lifestyle factors, alcohol. The more you drink, the more you have a problem with erections. So if you've drunk for a long time, over many years, you can have problems with liver disease, which can increase your estrogen, which has a negative effect on erections. Also, alcohol itself is like a nerve number, so you will have less sensation in the penis, again leading to decreased arousal, decreased erections. Recreational drugs, for example, cannabis, cocaine, speed, all these can have a negative effect on erections, and actually several years after stopping these drugs you can still have a problem with erections. If you're type 2 diabetic, it's really important that you don't smoke, you don't drink, you exercise well, you have a healthy lifestyle with respect to diet, and you limit your stress. Yeah, the trouble with high cholesterol is that it causes blockages in the arteries, so it furs them up. This narrows the arteries, and then that decreases the blood flow to the penis, and we need a good blood flow to the penis to create an erection. The best way to lower your cholesterol is to follow a Mediterranean-style diet. We know that research has shown that men who follow a Mediterranean-style diet have less erectile problems. So we're looking at things like high fruit and veg intake, high whole grain intake, lots of fruit, vegetables, fish, and less red meat and dairy products, and the occasional glass of wine. Erectile dysfunction can be the very first presentation of potential heart disease in men. This is because the arteries in the penis are much smaller than the arteries in the heart. So if the arteries in the penis get clogged up, and this causes erectile dysfunction, and these can clog up 2 to 3 years earlier than the arteries in the heart. Thus, the way to the man's heart is often through his penis, as this can be the first sign of heart disease. Definitely, weight loss is really important to optimise erections. Exercise is the best way, obviously, to lose weight, because that will increase muscle mass and decrease fat around the belly, which are all really important to optimise erections. Between 20 and 30 minutes of exercise twice a day increases your insulin sensitivity by up to 15 hours. So it's really important to exercise, because that will optimise your sugar control throughout the day as well. The other benefits of exercise obviously are that you feel better about yourself, it decreases stress, it will give you more confidence in yourself, and all these things can help with erections. If you're very good with your diet and exercise, you can potentially reverse your diabetes and make your sugar control back to normal. Men with erectile dysfunction and diabetes must have a testosterone blood test to rule out a low testosterone, especially because nearly half of them will have a low testosterone level. Erections will not improve without replacement of testosterone if the testosterone level is low, but it's not just the sexual symptoms. Having diabetes and a low testosterone doubles your mortality, so it's really important to have that checked as well. So if a diabetic man comes to me and talks about erectile dysfunction, the first port of call I'll advise him regarding lifestyle. So I'll advise him to lose weight, stop smoking, cut down on his drinking, sort his stress levels out, increase his sleep, that sort of thing. But following on from that, I think it's important to also treat these men to give them confidence in getting that erection. So I tend to also give them oral treatments initially to start off their treatment, just to give them that confidence that they can get an erection, and then we'll add in the lifestyle as well. Okay, so if a man presents with type 2 diabetes and erectile problems, firstly I start advising him regarding lifestyle, so I advise him to stop smoking, improve his diet, increase exercise, stop any alcohol, and improve stress and sleep. Following on from that, we also treat men with medication, usually in the form of tablets to start off with. I usually say you need at least 8 goes with a tablet before you can have any sort of improvement. So it does take a little bit of time. It's more difficult to treat diabetic men because there's lots of causes of the erectile dysfunction. It's quite multifactorial, so it's not quite as straightforward as men without the type 2 diabetes. So we need to modify all the factors associated with the type 2 diabetes and optimise their erectile potential. They can often be on other drugs that can cause problems with erections. Drugs affecting blood pressure often have a negative effect on erections. So we need to look at all of this and modify everything so they've got the best chance of having an erection. Okay, so if a gentleman doesn't succeed with tablets alone, there are several other options. These are usually done in the hospital, so they will need to be referred into the hospital for these treatments, but they include vacuum devices, injections and penile implants, all of which are available to the diabetic man on the NHS. I really don't think, as doctors, we're, to use the word, promoting the fact that diabetes can affect your sex life. I know from work that I've done that at least a third of men in diabetic clinics are not asked about their sex life or erectile dysfunction. And we know that men don't tend to come to the doctor that frequently. So when they do, it's so important that we do ask them about this. And as we've said, it can be a marker of cardiovascular disease as well as diabetes. And it's so important that we do ask about erectile dysfunctions when men come to the general practitioner. I mean, it is difficult to discuss erectile dysfunction, but I think as GPs it's our responsibility that we have to be open and honest, and we have to bring up the question. If we have the confidence to ask that man that question, it can change his life, rather than just leave the practice with a load of drugs or for diabetes or heart disease or blood pressure. We can change the course of his life, really, if we ask about erectile dysfunction. It's not essential that the partner comes with the gentleman to the consultation, but sometimes it can be nice if both parties are involved, and it can help with confidence, and I think it will be more successful with respect to treatment if the partner comes as well. So I always offer that opportunity for the man to bring his partner when he comes to see me regarding erectile dysfunction. So we know that up to 50% of diabetics can have a low testosterone, but then they don't always present with erectile dysfunction or loss of sex drive. Testosterone deficiency can be associated with other symptoms such as tiredness, lack of enjoyment for life, weight gain around the abdomen, and men describe it as a sort of general loss of oomph for life. I think it's so important that men come and speak to their GP about any sexual problems such as erectile dysfunction, because it's not just about sexual health and the health of the penis, it can be about health of the heart also. Men can present with erectile dysfunction when they're diabetic at any age. However, often the presentation of erectile dysfunction can precede a diagnosis of diabetes. So people presenting with erectile dysfunction, up to 15% of men under the age of 40 presenting with erectile dysfunction, it can be the first onset of diabetes. With a type 2 diabetic man, erectile problems present a lot earlier than those without type 2 diabetes. So they can present up to 10 to 15 years earlier with erectile problems than those men without type 2 diabetes.